So my name is Angelina Namiba, and I've been living with HIV for many years, more than 20 years. I do have a daughter who was born after my diagnosis. Luckily, I was able to take treatment, which meant that my daughter was born without HIV. But some of the important things that a woman living with HIV who is planning to have a baby needs to think about or needs to know include the fact that A, it's your choice, and also having HIV by itself should not be a barrier to you having a baby, if that is what you'd like to do or start a family. The other thing is that now we have very effective anti-HIV treatment, which not only means that you're not able to pass HIV on to your partner sexually, but also it means it can prevent you passing HIV on to your baby. But it also means that you can actually conceive naturally, provided that you have an undetectable viral load, which means you cannot pass HIV on to your partner. I think it's really, really important that you continue to stay engaged within the healthcare system, because that's the only way they'll be able to look after not just yourself, but your baby. I think one of the things that a lot of people make a mistake about, or rather in terms of how the care is done, is the fact that we tend to focus so much more on the woman who's living with HIV during pregnancy, and then not much is done after she's given a birth to a baby who's not HIV positive. And so it's really important that you stay engaged, not only just during the pregnancy, but also after you have the baby, because we know that a healthy baby needs a healthy mother. So you need to look after yourself so you can also look after your new baby. The other important thing to note is that unlike when some of us were having babies years ago, the guidelines have changed very much now. And so you have delivery options. So for instance, if your viral load is undetectable by the time you're ready to have your baby, it means that you can just have a baby, you can deliver your baby vaginally, just like any other woman. Of course, the advice in the UK is still to formula feed. However, women can be supported to breastfeed if that's what they choose to do. Of course, the right things need to be in place. So they need to have an undetectable viral load. They need to be able to continuously engage with healthcare, because there'll be more testing both for the baby and for the mom to ensure that the viral load is undetectable at that time. There's also support and information around women who are choosing to breastfeed. So there's guidance for what they need to do. There's also guidance for healthcare professionals to support the women who wish to breastfeed, because of course, you can understand the fact that some healthcare professionals may be a bit reluctant given the different guidelines that we have, in comparison to the World Health Organization's guidelines. But I think the important thing to note is that if women feel really strongly that they would like to breastfeed, and if everything is in place, their viral load is undetectable, they can be supported to do so safely. But what they need to do, the important thing is to speak to their clinic, to speak to the healthcare professionals who are looking after them, so that they can work together to ensure that if that's the route they're going to take, that they're actually supported to do it safely. So one of the important things for women to note is that it's really important to stay engaged in healthcare even after you deliver your baby, because you need to look after yourself, and you also need to look after your newborn. So it's really, really important that you don't neglect yourself and that you don't stop engaging in healthcare, because it's the best way to ensure that you both enjoy your pregnancy, you stay healthy, and your baby also stays healthy, and you can look after them well. And the other thing that is really important to think about as a woman who's planning to have a baby is, the power of peer support. It's really important that if you're thinking about it, or you're not sure, or you just need more information, of course, it's important to talk to your doctor, to your clinician in your healthcare team, but it's also really important to speak to other women. If you know other women who are living with HIV who've been through the process, they can support you in terms of just thinking through what they did, what worked for them, what didn't work, and what you need to consider, just so that you can have, a good journey, a good experience. Ask your clinic if you don't know of any support organizations within your area, so that they can link you in with peer mentors who can support you to talk through your pregnancy journey and to support you through it as well. You're not alone.